Today, we're going to talk about an increasingly troubling topic, and it's little discussed, the long-term dangers of contact sports at every age level. It's called CTE, Chronic Traumatic Encephalopathy. That's a mouthful, but it's a progressive brain disease caused by often unnoticed reported head trauma, and we're going to explore the latest breakthroughs in prevention, diagnosis, and treatment. So, Emer, it's great to be back together again in the United States. You're here this week, and I'm going to be joining you in one of our centers in Fairfax. But before that visit, we want to talk today about an increasingly troubling topic. It's the little discussed long-term dangers of contact sports at every age level. It's called CTE, Chronic Traumatic Encephalopathy. That's a mouthful, but it's a progressive brain disease caused by often unnoticed repeated head traumas. And we're going to explore the latest breakthroughs in prevention, diagnosis, and treatment. So as we get started, I hear you call CTE the silent killer. You're the only person I've ever heard say that. I think it's so very true. But why do you call it that? And tell us a little bit about the symptoms. We'll talk about symptoms throughout this broadcast, but why the silent killer?
And great to be here in the US. So the reason I initially started referring to CTE as the silent killer was really for two reasons. The first is that unfortunately, once people first start to present with the symptoms of CTE, the disease is already well underway. If it's not already sort of very established, it's certainly getting itself established in the brain. The other reason I call it the silent killer is because actually the type of injury that results in progression to this pathology of CTE is something called subconcussion. So we know that CTE occurs as a result of contact sports, a cumulative dose of brain injury and contact sports. But it's actually these subconcussions that result in this process in CTE rather than the big single hit concussions. So subconcussions, you are unaware of any symptoms. So that's the other reason why I've referred to it as the silent killer. I should just say, I know what you're going to ask me next, but before you do that, I should just say that, to be honest, once the disease has actually started to present and people start getting symptoms, it's anything but silent. It's actually a very noisy, intrusive, and devastating condition.
Well, we're going to talk about symptoms, but one thing, I think no matter where you live in the world, I think most people are aware of athletes that have been diagnosed or clearly demonstrate, some form of CTE. It's just pervasive now. And all you have to do is a simple internet search, and you'll be shocked how long the list is of people that you recognize. I mean, it's very, very chilling. So can you just share one story, perhaps, that stayed with you about the impact of CTE on an athlete someplace in the world?
Actually, Tom, as you just said, there are so many people and so many stories, and it is the stories that make it so much more personal and resonate, I think, with probably many of our listeners. If I may, can I just give you two stories?
Please.
I think they're sort of like really fundamental in actually the understanding of CTE. So the first one, which I think for our American listeners, many people will be very aware of, this was a very famous American football player who was inducted into the Hall of Fame. And he was Mike Webster. And in 2002, when he was 50, he died. And his brain was diagnosed by Dr. Marlew in Boston, and he was demonstrated to have this abnormal tau protein in his brain, which is characteristic of the CTE pathology. And in fact, he had become ill really in his 40s with progressive symptoms of sort of mood disturbance, angry outbursts, threatening to kill people, really severe cognitive decline, then eventually dementia, and then death. Now, what's really sort of quite interesting is that was when people sort of realized this tau pathology was the same pathology that had been detected on brain examination afterlife of a number of boxers, which had been known for ages as a sort of punch drunk syndrome. But then in 2015, the thing that really blew this out of the water was an individual called Zach Easter. And Zach Easter was much younger. He actually started to develop symptoms which latterly were recognized as being due to the beginnings of CTE when he was 8. And by the time he was 11, well, 8, he started playing American football. I apologize. By 11, he was complaining of headaches, bit of difficulty with his schoolwork, problems with memory, some speech difficulties, and then sort of like between sort of like 11 and 18, really quite significant mood changes. And then between 18 and 24, he was really unable to sort of like keep down a job. He found himself eventually, he wasn't working. He stopped playing American football when he was 18, but by the time he reached 24, he'd been reading about Mike Webster, he'd been reading about CTE, and he actually sort of like self-diagnosed himself as having CTE, and he felt he just couldn't go on. So he wrote a suicide note to his parents, and in that he said, please, can you get my brain examined by Dr. O'Malley, because I want to help future young amateur American football or contact sports players, because I think this is what I have. And then he shot himself at the age of 24. And then the other thing is that he wrote this extensive journal in the last sort of like 5 or 6 years of his life, which essentially, if anyone is confused or does not know, like, you know, what is involved in somebody developing CTE, they should read a book called Love, Zach, written by Reed Forgrave, which is essentially the compilation of Zach Easter's sort of like journals and diaries. And it's really extraordinary. So they're really the two cases for me that are the absolute sort of like standout and pivotal points in this disease.
Yeah, and they're both heartbreaking stories, and we've talked about it from time to time. And this is such a difficult topic. As contact sports, as we know, we see it in the U.S., I've seen it in the U.K., we've seen it in the UAE when we've been there. It is such an embedded part of social gatherings, cultural, community, coming together, families, and of course, it's got massive economic consequences and benefits, particularly in the U.S. now. It's really crazy. And we know awareness and education is so vital, but I think we've got such a long way to go. And I'm just wondering, do you think the advancing of stories as you just described and others will help change the conversation around athlete safety, or is it going to take much more than that?
I think it's going to take a lot. Unfortunately, you know, we keep seeing, you know, every month. I mean, there's 2 Australian rugby players who just died in the last sort of like in August with CTE. I think there just ultimately will be more and more people that everyone recognizes has this condition. But I think, you know, it's like smoking. I mean, it was discovered in 1960 that smoking was bad for our health. It's taken, I don't know, 40, 50, 60 years for people to actually sort of like really recognize the health risks associated with that. And sport, you know, sport is such, as you say, it's such a fundamental part of our whole cultural existence, and it, you know, provides the highs and the lows and everything else of life. But it does also bring considerable risk, at least contact sports, and particularly rugby, American football, hockey, soccer to a certain extent. And I think changing public attitudes will take a long time. But what's really important is for science to try to find biomarkers to enable early diagnosis of this condition, for protection to decrease the number and the force of injuries affecting the brain as a result of these sports. And of course, new treatments, which when given early, because it's possible through the biomarkers to detect evidence of disease, can actually prevent or at least slow down progression of the symptoms of CTE.
Well, I do want to contrast in just a moment and have you explain the differences or similarities, for that matter, of Alzheimer's and CTE. But what I do want to ask you about is innovative products for protection, maybe prevention, if you will. I mean, there are sports that most group sports or many sports are contact sports, and then there are what we call collision sports. And clearly, rugby is a collision sport. American football is a collision sport. They're not just contact sports, and there are others. But let's start, because it would be maybe the easiest or best example, around the U.S. football helmet. There's so much being said at every level, particularly at the NFL, of new helmets, new helmet designs, Guardian. You'll know the term. So tell us about the football helmet. How important is it to preventing or protecting against CTE?
Okay. And actually there's a lot of interventions that coaches and, sports bodies are making to try to make all of these contact sports safer. So let's talk about helmets. To be honest, the problem with helmets is helmets actually protect the skull from being fractured. And as a result of that, what tends to happen is that the force of the blow to the head, and specifically to the brain, can be much greater than if, for example, someone's not wearing a helmet. Because if you're wearing a helmet, then you're not going to get a skull fracture and be out of the game. You're going to continue playing because your skull is protected. But the real problem with CTE is it's to do with the brain. It's an injury to the brain that's the problem. And what happens is when you get blows to the body and to the head, because it's not just to the head, but to the body or to the head, the brain goes through a rotational acceleration or deceleration. And it's that rapid rotational movement that tends to tear little tiny micro vessels and little nerves. And it's the tearing of those vessels that actually sets up inflammatory reactions, which ultimately, if they get out of control because you get multiple injuries within a short period of time, what would be the normal protective inflammatory reaction actually becomes a harmful inflammatory reaction, and ultimately it breaks down something called the blood-brain barrier. And this is a sort of like a barrier which is designed to protect the brain. And if you break down the blood-brain barrier, then all sorts of things happen. And long story short, in the context of CTE, what happens is it results in the production of an abnormal form of a protein called tau. And it's this abnormal tau protein that spreads around the brain from one brain cell to the next that causes the destruction of those brain cells. So you actually have to protect the brain, not the skull. And the more you sort of protect the skull and the more weight in the helmet, the more force that the brain, which is just swimming around in liquid, is subjected to these rotational accelerations and decelerations. Now, yes, the Guardian caps, they're designed, I think everyone in the US will know about these, they're designed with lots of little bumps and things on them. And, they don't look desperately attractive, but they are said to reduce, if both players are wearing Guardian caps over their helmets, it'll reduce the impact, force of impact to each player by 20%. If one player is wearing them, it'll reduce the impact by 10%. But I think the verdict is still very much out on this, to be honest. I have read there's a new NFL helmet that's being designed for this season. Again, I don't know how that has a particular design such that it protects the brain. But I think this is why there are a lot of other things that people are doing. So, like I think one of them is instrumented mouth guards. Now, the thing with instrumented mouth guards is they will detect the amount of force the jaw and hence the skull, because it's connected, is subjected to, and that you can translate into how much force the brain is subjected to. But again, that would just sort of like, tell you that you've had a big impact, and you've got a concussion, but you can see you've got a concussion. What we don't know is what's the minimal cumulative force for subconcussions. And also, subconcussions, because you don't get any symptoms, it's hard to pull someone off the pitch when there's nothing at all wrong with them. So they're helpful for concussions, but you can see a concussion anyway. And then there's the, sort of like, if you get a concussion, again, this isn't helpful for subconcussions, but it's the, if in doubt, sit it out. So, they take people off the pitch. And then there's a sideline test, eye movements and a quick cognitive assessment, maybe a saliva test, maybe a blood test. Again, these are for concussions. You're not going to pull someone off the pitch if they've got an asymptomatic subconcussion. And then the other thing is trying to change the rules of the game, which usually is unpopular, but does get some traction. But again, it's difficult to monitor, and again, it doesn't make any difference to subconcussions. So it's difficult. It's difficult.
Yeah. Well, I think for the average person, as we listen to you talk about it, and maybe the research is there, but what's not known is how much is too much. Meaning, how many of these subconcussions can you receive and be in a safe zone, but without being able to measure those, which is, as you said, difficult if not impossible without some type of device. It's just terrifying. I think for any parent, anybody thinking about that sport, that information is kind of terrifying because you actually don't have enough information really to know when is too much. So I guess one of the questions I think everybody asks, what would you say to parents as they learn about CTE, understand that it's not the concussion, it's the multiple subconcussions, and you don't know how too many are? What would you say to parents about cautioning their children to play actively in contact sports?
So I'd say two things. I think the first thing that we do know, and a lot of this work has been done by Professor Anne McKee at the Boston Brain Bank, and this again is from post-mortem studies. And what she has shown quite conclusively is the amount of time that people spend playing is really significant, because that gives us some guide as the cumulative number of concussions that an individual sustains. And if you play for sort of like more than 14 years, you have a significant chance of having CTE, sort of like, if you like, afterlife, when she looks at the brain on post-mortem. And for every year that you play after 14 years, you increase the odds of having CTE afterlife by about 30%. So this cumulative risk is very significant. And the problem is you don't know when someone is 12 or 13, you don't know if they're going to be playing until they're 16, 18, 25, or 32. Like you don't know what sort of future they're going to have playing this game. The other thing, which actually comes from a very interesting report, came from Wake Forest in 2016, was that they looked at 8 to 12-year-olds who were playing American football for just one season, and none of them had any concussions. But on average, each child had about 200 subconcussions. And the number of subconcussions correlated with the degree of structural brain injury picked up on very sophisticated imaging. So, you compare that with NFL players are getting 1,000 to 1,500 subconcussions per season. So, these are
Wow.
big numbers for subconcussions. And I can compare concussions versus subconcussions for you if you like in a second. But the other thing too is that there's another report which was done to say, like, how young is too young. And this report said that children less than 12 years of age playing American football, in another study, grew up with more thinking and learning ability problems than their peers who started playing after the age of 12. So this sort of like isn't really too surprising, because the brain undergoes various phases when there's really sort of like critical brain development. And between the age of about 9 to 11 is a phase of rapid and critical brain development. So like in all of us. So if you damage your brain between the ages of 9 and 11, it has far more impact on thinking ability, behavior, learning ability, than if you had the same sort of forces to your head after the age of 12. So I would say to all parents, like, you know, like, I would not let my children play a contact sport of that sort under the age of 12, because I think there's just no reason to. I think the other thing is that it's to do with the cumulative number of years you spend playing. And I think, you know, the most important thing is having the knowledge and then making the decision. And again, I think children at a certain age can make the decision, but certainly below the age of 12, I don't think they can make a decision as to whether they want to play or not play or whatever. And I appreciate this is a very, very controversial subject, particularly for children who love sports and are in, you know, schools that are very, you know, very, very focused on sport, etc. And sports are incredibly important for children. But I think just contact sports, you just need to be sensible.
Well, yeah, and there is. Well, we'll come back to this as we close out in a few minutes. But I want to pivot just a moment to the question of Alzheimer's versus CTE and how they compare. What are their symptoms? Are they different, the same? Are treatments the same or different? And just a couple of podcasts ago, when I was with you in London, I had the privilege of meeting, and we actually had a very famous British footballer. Now, for we Americans, it's soccer, but he's quite an extraordinary, legendary player. And his name was Ray Clark. And we had him on our podcast. And he came to us, as I understand his story, and as we've talked, originally thinking that he had CTE. But I think with the work and the diagnostics that you did, you were able to actually confirm that he had Alzheimer's and not CTE. So it just raises the question, what's the difference?
Yeah.
And how should we think about it as lay people, I guess?
Yeah. So I'll try and sort of explain this as well as I can. So CTE, Alzheimer's disease, Parkinson's disease, to a large extent, the way to think about it is they're all sort of like the result of neuroinflammation. And it sort of goes down different pathways. And previously, people used to think of Parkinson's, motor neuron disease, Alzheimer's disease, CTE as completely separate conditions. Actually, they all sort of overlap. And even as we talked about with Ray Clark, and I'll explain why, even though his diagnosis from the biomarker perspective fell into Alzheimer's disease, it may well be that the numerous like subconcussive head injuries that he inevitably sustained in his long soccer career could actually have sort of like predisposed him to earlier development of Alzheimer's disease. But with respect to the specific biomarkers, as we call them, the specific proteins in the brain that start to misfold and behave abnormally, in Alzheimer's disease, the initial protein and the hallmark for this disease is an abnormal formation of amyloid protein that then gets clumped down in these big sort of like lumps, and they sit on top of the brain cells, and that causes those brain cells to stop working properly, and then they just atrophy and die. So we can diagnose the presence of Alzheimer's disease by detecting the presence of this abnormally elevated toxic amyloid protein. But actually, people with Alzheimer's disease, they go on to also develop an abnormal tau protein. And it's actually that tau protein that ultimately spreads through the brain and is more closely correlated with the progression of symptoms. Now, in CTE, it is tau protein that causes the pathology, and it's the tau protein that spreads through the brain cells in a relatively predictable fashion that results in the destruction of those brain cells and the subsequent symptoms of CTE, which are slightly different, but at the end are pretty much the same, but in their initial presentation are a bit different. Now, the tau protein, to make it more complicated, the tau protein in Alzheimer's disease is a bit different from the tau protein in CTE. And one of the problems is that whilst today we've got actually really good biomarkers now for Alzheimer's, we've got amyloid biomarkers and tau biomarkers, both blood biomarkers, spinal fluid biomarkers, and actually something called PET, imaging biomarkers. Those tau biomarkers for Alzheimer's are not sufficiently accurate for CTE because it's a slightly different tau. So what one will very much, and there's a huge amount of work going on currently with lots of different research studies to find equivalent biomarkers for CTE so that we can pick up in the blood, in the CSF, on PET scans, we can pick up the presence of the CTE tau, ideally, before it even starts to develop symptoms. And that's the big breakthrough, because if you can develop, as we can today, the presence of the pathology in the brain using biomarkers in the blood or spinal fluid or whatever, you can detect the presence of the abnormal pathology very early on, or ideally even before symptoms start, then you can develop treatments which will correct that abnormality. But if you can't detect it, it's very difficult to create a treatment that will be effective. And for any disease that's progressive, you have to treat as early as possible, just like diabetes or blood pressure or anything else.
So I think if anybody's listened to the podcast in the past, they recognize we spent some time talking about two of the new drugs that are out now, commercially available, Kisunla and Leqembi, for treatment of Alzheimer's, which focuses on, I guess, amyloid. So are either of those drugs beneficial to a CTE diagnosis, or are they solely really available just for an Alzheimer's diagnosis?
So those two drugs, Leqembi and Kisunla, which, like I hope people are aware of, they are monoclonal antibodies against the toxic amyloid protein, which, as I say, is the hallmark for Alzheimer's disease. So CTE doesn't have amyloid protein, so they are not relevant to CTE. But there are a lot of other medications that are being developed for Alzheimer's disease to attack the abnormal toxic tau protein in Alzheimer's disease. And it may just be possible that there might be some overlap between those anti-tau drugs for Alzheimer's and the tau pathology in CTE, even though they're not exactly the same tau. And actually, I do mention, because I know we're probably shorter time here, but I do mention in my TED talk, the TEDx talk, that we have actually been working with a drug called HMTM, which is invented by TauRx Therapeutics in the UK for rugby players who actually present with CTE even earlier than American football players or soccer players, because they get even more head injury and more subconcussions. And that drug's HMTM. We've been giving it now to professional, sort of like ex-contact sports players in the UK for about 2 years, and potentially early results are looking quite promising. But that's really just to say that there's a lot of work and a lot of research going on at the minute to protect the brain from head injuries, to find biomarkers to detect the presence of this disease as early as possible, and ideally when it's still asymptomatic, and the development of new treatments to treat the disease whenever it's detected.
In all the discussions that we've had about Alzheimer's and CT, one of the group of people we've not talked about, and I think maybe in another podcast we will, and it is the military and the serious issues of both blast injuries. I just recently saw a report of the great concern over Navy pilots that basically have controlled crashes 1,000 times coming off, landing on, and accelerating off aircraft carriers, and the concern that the military now has on cognition issues as a result of, again, force of that starting and stopping and what happens to the brain.
Yeah.
So, Emer, I think in that whole discussion about contrasting and comparing Alzheimer's and CTE, if someone has an early diagnosis of CTE, is there anything we have learned through the many trials that we're doing at Recognition Health? And I think we've administered probably as much of Kisunla maybe as anybody. So we've had lots and lots of experience. But is there any lessons learned here for someone that might have a CTE diagnosis?
So I think I've got to go back one step here first. At the minute, the pathological diagnosis of CTE is not really possible without doing a post-mortem examination of the brain and seeing the tau protein. We're getting very close. Once we have a biomarker, the same way as for Alzheimer's disease, then we can confirm a pathological diagnosis, while the brain is still in the person as opposed to in the lab. However, it is now really very possible to make a clinical diagnosis, and we have a lot of patients in whom we have a clinical diagnosis, and that is a combination, and Ray Clark's actually a very good example. That is a combination, particularly when people are presenting really quite young, because Alzheimer's is a pandemic, but the most common risk factor is age. And whilst people do develop Alzheimer's in younger years, and particularly in their 50s, generally speaking, people tend not really to present with Alzheimer's in their sort of like 30s and 40s. At least it's very, very, very rare. But for rugby players, they tend to present with a constellation of symptoms, and you have to know what those symptoms are, with a history of a huge number of years of playing and subconcussions, in their sort of like mid-20s to probably latest, like, mid-40s. So they have a huge load, a big cumulative amount of subconcussive brain injury. American football players are closer to sort of mid-40s to mid-50s, and then soccer players are closer to mid-60s to sort of like 70s. So in the soccer players, it's particularly difficult, and I'm going to call it the older presenting American football players, because they start to overlap with when the younger people can present with Alzheimer's disease. So there's two or three things. One, which is exactly what we did with Ray Clark, because he actually had he was diagnosed to have positive amyloid protein on sort of like PET or CSF. So we knew he had the amyloid protein. So we knew in his case that he did have the pathology of Alzheimer's disease. Now, if you're in your 30s and you're presenting with these symptoms with the right clinical history, we actually do very sophisticated MRI studies which look at something called diffuse tensor imaging, and it's looking at the white matter tracts at a microscopic level. And if we see brain damage at that level fitting absolutely with the history and everything else, then, and they don't have high amyloid and they don't have another reason for having these symptoms, then they are the people generally who, if unfortunately, they do die and their brain is looked at, they have the high tau protein. So it's a difficult area at the moment.
And I suspect, I've never really asked you this, most of the brain research in this area has probably been on males because of more male contact sports. But given the huge, growing, and very exciting uh, again, soccer among females. Is there any difference of concern or levels of concern, whether male or female?
There's generally a concern that I don't know how to phrase this. There is a concern that we should be even more concerned about females playing, like playing contact sports. But again, it's the same measures in terms
Right.
of trying to provide sensible protection. But I think that, the really big things is that a big concussion is like never a good idea for anyone. And, like after three concussions, you really need to, be extremely careful and reflect. You probably saw that very well-known rugby player on the Lions team on the sort of like big world tour who said he wasn't going to play just recently. It was, that was a sort of like a match of a lifetime, and he said, no, I've had a concussion and I'm not fully recovered, so I'm not going to play. But it's the real problem, as I say, is the few concussions are never a good idea, but it's this cumulative exposure to subconcussions.
Yeah.
And the other problem is, it's like everything, is some people, like Zach Easter, some people are going to be more susceptible than others. And we don't know who are the people who are more susceptible than others. Exactly the same as, in the military, some people are in a particular war zone and they get PTSD from blast injuries, etc. Other people are in exactly the same situation. They don't get PTSD. So it's exactly the same as Alzheimer's. We're all living more or less the same sort of life, and some people get Alzheimer's and some people don't. So it's nurture nature, and we don't know who are the people really that are at more risk.
Well, this is such an emotional topic because, as we said earlier, contact sport is so vital. There are so many lessons to be learned among team sports and contact sports. Economies benefit substantially, communities benefit. It's so embedded in the culture. And it would be unfair to ask you, and I won't do this, but I think the question has to hang out there for everybody, and that is, should there be modifications to contact sports, and or should certain age groups be restricted from contact sports? These are very difficult, challenging questions, and they'll be debated for a long time. But what I do feel, and I know you do as well, we just need to get full disclosure and information in the hands of parents and young men and women. And just like you used the example smoking, there are still millions of people that smoke, but they're fully informed and they do it at their own risk.
Yeah.
But we do try to restrict children from
Yeah.
smoking
Yeah.
because they're not old enough to make necessarily good decisions.
Yeah.
So let me just end with this question. If there's just one thing you want our listeners today to walk away from this discussion on CTE, what would it be?
I think it would be to do not have your head in the sand. I think for yourself, depending, obviously if you're a young person, you're playing lots of contact sports, just look this up, find out, and then make a fully informed decision about what you want to do. I mean, it's just the same as drinking or taking drugs or anything else. Like, just make a fully informed decision about what you want to do. Because I do have a lot of ex-professional contact sports players saying, well, I knew that I'd have shoulder pains and leg pains and my back had hurt and my neck had hurt for the rest of my life. But I was happy with that. But so many of them say, but I didn't know it was going to do this to my brain. And I think just be fully informed. The other thing I would say to parents of children is, please, I would say, please listen to my TED Talk, to be honest, not in any way that I'm advertising my TED Talk, but because I think that that will give you the sort of like something to, it'll give you information digest and find further information from. And actually, I would read the book, Love, Zach, because if you read that, you'll know everything there is to know. But at the same time, you can't wrap yourselves up in cotton wool, and life is fun, and you have to lead life and live life, and life has risks and benefits, and just be informed, make informed decisions for yourself and your family, and have fun.
Yeah. So, Emer, I had referenced it earlier, but I just want to come back and be really clear. What are the symptoms of CTE that someone should be alerted to?
So the first thing I'm going to say is these symptoms are all progressive, and people can present with slightly different facets of these different symptoms. And also it's recently been sort of like noted that younger people tend to present more with behavioral changes, and older people presenting with CTE tend to have more memory problems, cognitive problems. But let me just take you through all of the different symptoms, because any individual can have a sort of constellation of these symptoms. So they are things like sort of like confusion, disorientation, and headaches initially. And then they can progress to increasingly severe memory loss, usually short-term memory loss, impulsivity, poor judgment, depression, and then ultimately sort of like movement disorders. I cannot emphasize how much this low mood, and when it's mood disorders, it's more low mood, that can become very dark. And one of the problems with that is that can pose quite a high suicide risk. Then the final stage is it's really progressive dementia, along with tremors, vertigo. So people finding it very difficult to sort of like, stand straight almost. And then what we'd call sort of like sensory processing disorders. So they have difficulty almost like knowing where they are in space. And then that really sort of like can progress ultimately to really very severe sort of like end stage dementia. A number of people, the low mood almost like takes over, and they can become very suicidal. And suicide is sort of one of the more common causes of death with CTE. And as I said, particularly in the younger people, and Zach Easter sort of like exemplifies, that progression of disease. Ultimately, people tend to lose insight. But what I think is very frightening now, particularly since there's so much in the media, is when people have insight and recognize this may be the condition that they have.
Emer, it's always great. An hour goes by, or 45 minutes, so very fast as we talk about these topics. Here at the brainandmindexperts.com, we want to be a trusted source of information about Alzheimer's, CTE, and other brain and mind issues. And we're going to continue to bring our great listeners reliable, actionable news on cognitive disorders. And thanks so much for everybody listening.
Thanks, Tom.
That was Dr. Emer MacSweeney, CEO and Medical Director of Recognition Health. Dr. MacSweeney is a highly recognized neuroradiologist and an internationally renowned expert on cognitive impairment disorders such as Alzheimer's and CTE. I'm very happy to say she is both a family friend, a colleague, and the co-founder with me of Recognition Health. I assure you, you will want to hear her TEDx talk on CTE, the silent killer. It's been viewed now by more than 4.5 million people. Thanks for joining the Brain and Mind Experts, the podcast where we talk about the world's most advanced diagnostic techniques and innovative treatments for cognitive disorders. Each episode, we will bring the latest news and information about how we can potentially help the more than 55 million people worldwide affected by cognitive impairment. And this is forecasted to grow to 150 million by 2050. I'm Tom Dent, Executive Chairman of Recognition Health. And in 2011, Dr. MacSweeney and I saw this growing health crisis, and we wanted to be a part of the solution. We believe we could assemble professionals, processes, and strategies to provide a specific diagnosis and then provide the newest treatment and care for people with cognitive impairment in the United Kingdom, in the United States, the United Emirates, and around the world.